you're planning to sit the AMC MCQ, I'd highly recommend that you continue watching this video. So today we've got another psych question for you guys. These styles of questions are always fun to do, so let's get straight into it. We have a 24-year-old woman who presents to your clinic after another intense argument with her partner. She reports rapid mood swings, feels empty when alone, and says she can't stand it if people pull away. She has a history of superficial cutting, binge drinking during stress, and unstable relationships that flip between idolizing and hating others. Which diagnosis best fits her presentation? So let's go through the options. So option A, bipolar disorder. This is not the correct option. So in order for you to diagnose it as bipolar disorder, you need to have distinct hypomanic and major depressive episodes. So in this case, her mood changes are occurring within hours, not in the days. So if it was a hypomanic episode or a major depressive episode, that usually occurs over a longer period of time. And her mood changes here are also tied to relationship triggers. So it's not a discrete episode of bipolar 2. So for this case, we can rule that option out. Option B, borderline personality disorder. So this is the correct option. So borderline personality disorder is characterized by unstable relationships, being impulsive, self-harm, fear of abandonment, emotional instability, chronic emptiness, and intense anger. So this is exactly what this patient in this case is presenting with. So that's why we can pick very easily option B, and I know majority of you would very easily spot that one out. Option C, histrionic personality disorder. So this is wrong in this case because the traits for this one are, you would see a person who was very attention seeking, dramatic, flirtatious, and very shallow emotions. And in histrionic personality disorder, there is no self-destructive behavior or intense anger. So that's what would really differentiate it from the borderline personality. Option D, dependent personality disorder. This one is wrong. So in this one, you see a submissive, clingy person who has a fear of abandonment or separation. But these feelings are all passive and not really chaotic or self-harming in a way. Option E, major depressive disorder. So this is wrong because in order to diagnose, you need at least 2 weeks of depressed mood or anhedonia, loss of interest in things that they normally would have. And at least a few of the other symptoms of depression, such as maybe reduced appetite, inability to sleep, and so on. So in this case, she is reactive, she's unstable, not persistently depressed though. So that's it for today. A nice, quick and short one for you guys. I hope you guys enjoyed. Please give us a like and a follow, and we'll see you guys in the next one.